Hi, welcome back to the Dr. Mia Paquin podcast. We are delighted to have our guest here today, Dr. Abby Hughes-Scalise. And Dr. Hughes-Scalise is from Augsburg, and we are going to be talking with her today about going to graduate school after you get that undergraduate degree in psychology. But before we get started, are you okay if I call you Abby?
Yes, absolutely.
Okay.
Yes.
Abby, tell us a little bit about yourself, how you got interested in this field, and how you got to where you are today.
So I, right now my job is I'm the program director for Augsburg University's PsyD Program, which is specifically a doctoral program to become clinical psychologist. But prior to that, I was a practicing clinical psychologist. I worked in health psych settings, so hospitals, working with kids and adolescents mostly, that had psychosocial, psychological, and physical health concerns, and that kind of mix of how you work with those things. But then prior to that, my training was I got my PhD in clinical psych from Case Western Reserve out in Ohio, and I got into it. I think largely, I was very sort of wanderer in college, didn't really know what I wanted to do, liked a lot of things. I was always good with people, always good with kids, and I did an internship over the summer just to make some money and have an experience at Washburn Center for Children, which is still running around the Twin Cities, but worked in a classroom with kids that had really severe behavior problems, and just really got excited about this idea of intervening early, helping kids kind of get back on the right track, whatever that looks like for them, and really feeling like my skills and excitement about building relationships had a place that I could make a career out of that. And so started looking into programs after that internship, and feel really lucky with kind of where it's landed me and how it's gone. So yeah, well, it just made it real, right? Like you take these psych classes and it all sounds interesting, and different disorders and things like that, but then actually being with people who are experiencing those things and having those struggles and thinking about, like, what is it that you need and how do we help you to the next place you want to be. Something about making it real really got me much more excited than I could in a class, for sure. Yeah.
And then how did you go kind of from the jump from kind of the clinical world to being a teacher?
Yes. So it's so funny because I was in this PhD program, and I loved what I was doing, and by the end of the PhD program I was pretty burnt out, and my PhD program was very heavy on research, and I thought, I came here to practice, I came here to work with people, and I want to be out there, and so I very much took all these clinical jobs right at the beginning. And what I started to recognize was that part of what I loved about working with kids and families and adolescents, number one, is I liked the teaching aspect of it. I liked the relational aspect, but I really liked the idea of teaching. And then I also started to get to do some supervision as part of my role, and working with people who were new in the field and honing their clinical skills quickly became my favorite part of the job. And I hadn't had any opportunities for that until I'd gotten into this clinical work. I was a little bit removed from grad school, and sort of realizing that I actually had a really, really good time in that setting, and I really enjoyed the environment of just getting to the whole point of being there is to learn and expand and grow, and wanting to really get back to that. And I have a lot of teacher roots in my family, so I'm a professor. Three of my cousins are professors. My grandfather's a professor. My uncle's a professor. So there's some kind of teaching feeling about that, but especially getting to teach in a program that's specifically for people who've already made the choice to pursue this same field that I'm in is really, really rewarding. It's been really fun. So I just wanted to get back to teaching and supervision and having that kind of mentoring relationship with students.
Well, and I can imagine that having that clinical background too just makes you an even stronger professor.
Well, that was what the interesting part too was I initially thought that, because I had clinical experience, that was somehow going to be a disadvantage getting into academia because, there's this very strong narrative of like publish or perish and, but realizing in PsyD programs especially that are more focused on clinical practice, clinical training, my clinical experience was an asset.
Yes.
And that really shifted things for me of like, oh, this is really viable and I can contribute in a really unique way in these programs that I might not be able to in a more traditional PhD program. It's been really fun.
Well, I'm going to jump right in because I would love to get to know. I know a lot of people are interested in knowing, like, I'm thinking about grad school. How do I pick a grad school program? What do I look for? And you just mentioned a couple of different things. The PsyD programs, which are doctors in psychology, and a PhD program. And I think for a lot of people, they don't know the difference. What's a PsyD? What's a PhD?
No, I didn't know the difference when I was applying.
Right.
I did not know. I was like, something sounds important about these things.
Yes. Like, what's the difference? Can you talk a little bit about like, what does that mean, PsyD versus PhD?
Yeah. All there was PhDs. So it's a pretty traditional model of you go, you're meant to become sort of a scientific expert in your field with a PhD. And so one of the ways that the term for it actually in clinical psych programs is a scientist practitioner model, meaning I'm a scientist first. I care about advancing the field and discovering new things and honing what we know about evidence-based practice. That's my primary role. And then secondly, I want my work to impact my other people's abilities to practice or potentially my own ability to practice. But I'm a scientist first. And PhD programs are really built largely around that idea that you go in and you typically go in under a specific faculty member who's got specific research that they want you to help them with. And you're doing research the entire time that you're there, and you're also getting some clinical experience along the way so that when you're done, you can either be a researcher or an academic or engage in private practice. So that's the PhD model. PsyD model, the doctorate in psychology, really hasn't been around as long, but has really been a strongly influenced the field since its arrival. They flip it and say we are practitioner scholars, meaning what we are first is we are strong providers, strong mental health providers that are really based in, that's the work I want to do, that's what I want to be responsible for. And that practitioner scholar piece is that I'm going to use the research skills I learn and the academic kind of literature that's out there to inform how I'm going to do my best work with my clients. And so typically in those programs, there's still some research we want to be able to build those skills so that you have the ability to read the newest thing and integrate that with your clinical care. But the main focus is how do we really help you set up to do the work of the healthcare provider or the mental health provider in the field. So, but either way, they're both, you both get a doctorate at the end of the day. And actually both options let you have a lot of flexibility in your career. Like you can go into academia with either degree. You can go into research with either degree, and you can practice with either degree.
Yeah, great. Yeah, I think that it's a little bit harder to differentiate.
I do think that's
from
true.
PsyDs. So, which is not necessarily a bad thing. I mean, I came from a PhD program, and it was, I think whenever somebody came from a PhD program, and then it was kind of like, oh, but I kind of want to go clinical, and it was kind of like you had to say it in a quiet voice. Yes, and it's like, no, like it's wonderful that we have all this research background. It can bring science to our clinical practice. And so the PsyD really has evolved in that way really to help with that piece of it.
I know we'll probably talk about APA accreditation at some point. It's part of it is that both of those PhDs and PsyDs are accredited by and overseen by the American Psychological Association. And so in that way, I think that's also creating more similarities than differences between those degrees. Yeah.
Okay, so you said we are going to talk about it. Let's talk about it now.
Yeah, sure. Perfect.
So APA accreditation, why is that important? So if somebody's thinking, I want to go get a doctorate in psychology, why do they need an APA accreditation?
Yes. I think this is such an important thing. Essentially what's happened, if you want to get a job as a psychologist after the fact, or if you want to get licensed as a psychologist, the licensing boards and a lot of places that want to hire psychologists are saying you need to have graduated from an APA accredited program. And the reason they're saying that is because APA has very specific expectations for what gets taught in these programs. And they check up on you on the regular to make sure that you're actually teaching what APA has decided is important for psychologists to know. And so in that way, to set yourself up for success in the long term and to maximize your ability to get licensed and do the clinical work you want to do, getting in that APA accredited program is really key.
Yes.
Yeah.
Absolutely. And the other thing I just found out, I don't know if you're aware of this. So now a big thing for people who are practicing is the e-passport, right? In order to practice from state to state. And if we just learned this, that if folks do not go to an APA accredited program, they can't practice between states. And so like looking ahead, that's the future of psychology. So how do you really, your future career really depends on kind of an APA.
And I think a misstep for a lot of people in grad school is that there's an assumption that once you're done with grad school, you get to go be a psychologist.
Yes.
And I mean, to be honest, I thought that as well when I started grad school.
Like what? How many more hoops are there?
Right.
There's a lot.
And there's a lot. And so I think that piece of you don't get to just immediately practice right after you graduate. You have to take a licensing exam. You have, for many states, including Minnesota, you have to do a year-long postdoctoral training. And having that awareness, it's like there's already enough hoops. Don't let APA accreditation be one of them. Like just get into an APA accredited.
Save yourself that headache. Well, and I also, I mean, not to go back to this fellow, but she shared with me that half of her class ended up going into different fields because they were blocked so many ways. So I guess kind of our advice to viewers who are considering this is to make sure that you do an APA accredited program.
And it's very easy to find them. APA keeps a huge list. And if it's not on the list, then it's probably not worth, if you can find another place, go there.
Okay, so another question that folks may have is, okay, I want to do clinical practice. You probably know where I'm going.
I think so.
So why am I going to go to school for 6 years and get a PhD versus some of these master programs are just a year and a half, right?
And they're online.
And it's easy and I can work full time. And so why would I go get a doctorate degree? So I'm going to throw that to you.
I think, if your goal overall is I want to get out there and I want to do therapy and I want to be doing that clinical work 40 hours a week, there might be some master's programs that are great fits for that. The problem, or not, I shouldn't say a problem, but like the limitation of that is that that's oftentimes the max of what you can do. Over time, you might be able to apply to become a master's level supervisor, but most of the time, if you get a master's, that's kind of where the work begins and ends, is in those therapeutic settings. With a doctorate, not only can you do therapy, but you also can do psychological assessment. This is another thing that people often don't understand, is that there's specific types of assessment that only doctoral level clinicians can do. And I've heard people like go into a master's program thinking they're going to get to do that and finding out a year in that that's not actually something they're going to be qualified for. So if assessment, things like IQ tests, personality tests, being able to diagnose things like OCD or personality disorders, you've got to land in a doctoral program.
Yeah.
There are other specialized settings. A lot of people are really interested, especially in the day of true crime that we're in, in forensic assessment or, forensic psychology, and you need a doctoral degree to pursue those things. I also think the earning potential is more.
Yeah.
That for a doctoral degree than a master's.
Yeah.
And the last thing that I think a lot of people don't recognize is if you get a master's, you don't actually start practicing independently for a number of years, right?
Yes.
Like you're having to still get supervised training for at least 2, and for some places 3 or 4 more years before you're independently licensed.
Yes.
So it actually, in order to get independently licensed as a master's level clinician, it's not actually that much of a time difference between that and getting a doctoral degree.
Yeah.
So, but I think it's a great question because we look at that a lot of times in our application materials too. Like, does this person actually want to be a psychologist?
Right.
And if you want to be a therapist, that's great. There are more avenues available to your education that way. But if you want to be a psychologist, you've got to get the doctorate.
Yes.
Yeah.
And only if you have a license or you're teaching can you even refer to yourself as a psychologist.
Yes, that's so true. Yeah. So actually, even in training, you're not allowed to say that. You can say you're a psychology trainee. Even after you've graduated from your APA accredited program, you're still a psychology trainee until that LP, that license, is behind your name. Yeah.
Wow. Yeah. Yeah, and the other thing that strikes me, just because we've had folks come and train with us. I mean, we Psychology Express that I work for, aside from this podcast, Psychology Express only uses doctoral level psychologists, and there's a reason for that. And in my many different clinical roles that I've had over the years. We would have folks independently licensed at a master's level that have never done a diagnostic assessment, which is where you actually diagnose somebody, or they're coming to you and their niche of what they've learned how to do is so small. Yes, so narrow. And whereas in psychology, I mean, I correct me, but I think that first year you're ingrained in making the right diagnosis,
right?
And so. And in the school that I went to, and maybe this is true at Augsburg, I mean, it's kind of, it blows my mind a little bit, but if you don't know what the diagnosis is, what are you treating?
Yes.
Well,
and I think that there's just a level of, I think the other part that's really exciting about a doctoral program, and this is true in higher ed everywhere, but is that sense of, we're not just teaching you how to work with clients, we're teaching you how to be a lifelong learner and how to continue to we're giving you skills that allow you to be flexible in your career, flexible in your approach with clients. And I so strongly value that flexibility and the ability to really reinvent your skill set and what you want to do multiple times throughout your career. And I think it's much easier to do that with a doctorate degree because of all the avenues that are open to you.
Right.
Yeah.
Absolutely. I mean, I think sometimes people will say, oh, it's elitist if you just promote the PhD PsyD. There are things, I think master's level folks do a really good job in these niche areas. And one of the things that I'm always really clear about is, I think especially those who have LMFTs do such a lovely job with the family systems. Not that we don't have psychologists that do that work too, but they just look at it in a different lens. And so there are areas where, there is a place for that as well. One of the things I've noticed in getting prac students from, as we work with prac students, and actually I should, before I go there, can we talk about what prac students are? What is
Yes, any PhD or doctoral program is the actual on-the-ground clinical work that they get while they're there. So in our program, for example, at Augsburg, we have 3 different practicums. It's what we call their intern experience. But in graduate school, it's called practicum experience. You go out into the field for 16 to 20 hours a week. for the entire academic year. So we've had students with you for 9 to 12 months, and they get to really do the work that your group is doing. And we have some students come to outpatient practices like this. We have some students who are placed in hospitals, in prisons, in school settings, but really getting to do the exact same work with a lot of great supervision that a psychologist will do. One of the cool things I think about doctoral programs is it's still really a mentorship model. Right? Like you're coming in and you get paired with a supervisor who's already a licensed psychologist who really sees it as their responsibility to bring you into the field, not just in terms of the clinical skills, but like how do you bring yourself into this space professionally, and how do you manage billing, and how do you manage the kind of ethical issues that come up. And so I think that mentor piece is something that is really fun about the practicum experience, especially. Yeah.
Yes, and all the psychologists have been there themselves, so they know, like, you know, I've been there. I remember what I was afraid of, you know, like, ooh, maybe I don't have this piece of knowledge, and to get that supervision and mentorship or confidence.
And when you're learning a new skill, how nice is it to have somebody really side up next to you and walk you through that space. And we have some students come in with masters and they're much more comfortable and need less hand holding or less overt sort of guidance like that. But I think supervisors are really good at knowing sort of how to match what the student needs. And it's so individualized. You know, students really get to figure out who they are and who they want to be in the field through those experiences.
Absolutely. What does it look like? So when somebody enters the doctoral program, you know, like kind of obviously there's a lot to the 6 years that they're training, but talk to us a little bit about like what do they do in that first year versus second year?
Any program you go to, well, your first year will largely be in the classroom.
Okay.
And it's such an interesting thing because you apply because you want to go help people and you want to work with people, and then you get there and you're so excited and we're like, here's all your books. Just read a lot. Like do all the reading. And so, but it's really getting all those foundational courses set to go. You're taking stuff on ethics and on lifespan development, definitely on psychopathology or abnormal psych is what I know a lot of undergrads still call it. So all the things that you're going to need to know, basic skills, diagnostic interviewing, in terms of how to actually start this work in the next year. So first year, you're doing a lot of coursework. You're learning how to give IQ tests and personality tests. And then in the second year, that's when most programs start their first practicum experience. And for us, we take a really developmental approach because we want you to really feel solid in that differential diagnosis, understanding how to really define the strengths and the growth edges and concerns that this person's presenting with. And so for our practicum in that second year, the very first one students do, it's all psychological assessment. So you're doing clinical interviewing, you're learning how to build a test battery and administer that, and then pull all this information together into a really cool integrated report that helps that person know where they're going to go with their next steps. And so, and then at the same time that you're on that practicum, you're still taking more classes and continuing to grow that knowledge. So for our program in the second year, you're doing your stats and research sequence. To get to know how to engage with that part of the field and how to hold research questions. And then also in the second year, you're taking theory and therapy courses. So how do we think about things from a cognitive behavioral lens? How do we think about things from a family systems lens or psychodynamic? So that you're ready then in your third year to do the next step in your practicum training, which is that therapy practicum. So in that practicum, you're doing diagnostic interviews still, but mostly that kind of deeper therapy work. You know, how do we help somebody with depression move from that space to a life that feels really fulfilling and exciting for them? How do we help this kiddo who's got ADHD figure out how to manage those things in a way that keeps them friends with their peers and helps them do well in school? So you're doing that in the third year. And then typically in most programs, including ours, that third and fourth year and fifth year for some programs is really about you getting more clinical experience, but also deepening that research experience. So you're starting to create your own research project and thinking about what question in the field do I want to answer.
Yeah.
And typically you get paired up with a specific faculty for that.
Okay.
So in a PhD program,
Yes.
you're with whoever you've been with the
Yes.
entire time.
Yes.
PsyD programs are a little more flexible. You can pick somebody in your third year that you just feel really connected to,
Yeah.
and or have similar research interests. But then you square up with that person, and they become your research mentor, kind of for the rest of your time in the program. So you're doing that, and your third year you're doing therapy prac. You're taking a couple more courses, but eventually courses get less.
Yeah.
And you get to feel like you're doing more of that kind of the clinical work of a psychologist. And then for us, in the fourth year or fifth year, depending on kind of how long you're taking in the program, you're on an advanced practicum, which is really at that point for us when you as a student get to say, I want to specialize in this exciting area, or I want to deepen my generalized knowledge across different skills. And you're also applying for internship. Anybody who graduates from an APA accredited program has to complete also an APA accredited internship. The internships are different than practicums. Practicums, your program sets up for you. So we have a training department. They do a ton of work to make sure students get put at good sites, and the sites are excited for those students. But for internship, you as a student are applying sort of nationally. So anybody who is in the same place as you in a graduate program across the country is also looking for these. And so typically it's a national search process. You're applying to 15 different places, and the goal is to get an internship that is a year long. It's not really housed in your doctoral program. It's its own special experience. It's 40 hours a week. It's really like the first time you're having sort of a full-time job-like experience as a psychologist. You're still getting tons of mentoring and tons of supervision, but that application process is happening during your fourth or fifth year. And then your fifth or sixth year, that's when you're actually completing that internship, getting all of that, and it's a really exciting time. You finally kind of feel like you're spreading your wings a little bit, and then typically also in that fifth or sixth year, you might be wrapping up your research too. Some people are very lucky and have it all the way done before they go on internship, but most people are wrapping that up. Your classes are done by that point, so you really are just getting to be in the field, learning on the job, and then eventually that is done too, and you get that degree. It's very exciting. So but it's a full time. And I think that's important to think about too. Like, it really is a full-time commitment when you're deciding to pursue a doctorate.
Right.
So, and that's hard. It's a big ask.
Right. Because you're really kind of putting income on hold, right? And you're paying, right? In some cases, right? To go to school. So it's a huge investment. And at the same time, like it's I think both of us would agree it was so worth it.
Oh, so worth it. And I think like if you're gonna come and you're gonna put yourself in our program and to and all the resources that entails, financial, social, that we're really going to care a lot about making sure you make it. I think that's the other part that sometimes people really view doctoral programs as kind of intimidating, and like I have to prove myself, I have to prove, and there's a lot of imposter syndrome, I think, too, at the beginning of grad school. And I think one of the things that our program tries really hard to do is to communicate that actually to make it in this field, you need to be in community with other people. And you need to have that support both outside the program, obviously, but also to feel that support within. And so we work really hard at making sure that our students are feeling like they can get support from us, they can get support from each other, that nobody's testing them. We have to evaluate how they're doing. Obviously, that's part of school. But that really, our goal is to have you come to our program and know that we are just as committed to you succeeding as you are. Right. And I think that can be something that keeps people a little bit at bay with doctoral programs.
You're really investing in them. When you say, hey, we accept you, we want you to come here, it's a big deal, because and you know, once you get in that cohort that you're in with, I mean, my two best friends are from my graduate school cohort, right?
Absolutely.
Like, and we're, you know, spread out across the country, but you stay in contact with that cohort because they're like your family, right? During grad school. So, but the professors too, right? Like, and so it's just, it's kind of this mini family that you're all just developing together.
It's so true. And I think too, you know, I think that another thing about doctoral programs is because we take that commitment seriously, it's a smaller community, right? So when you get into a master's program, you can be one of 30, one of 50, you know, and especially if you're online, you know, you're not really meeting them in the same way or connecting with them in the same way. And so when you think about, you know, our program, we've got, you know, 8 faculty, maximum of 24 students a cohort. People are going to really get more, they're just going to get more of us, and we want that. Like, that's part of what I really like about these programs, is that ability to make those strong connections and to feel like that professional mentorship is a huge part of what we do.
Well, and Augsburg has such a strong reputation. And you guys are the clinical program. I mean,
we are in Minnesota. In Minnesota, So we're the only clinical PsyD in Minnesota. So there's a clinical PhD program, and there's some counseling PsyD programs. But that specific niche of really being interested in diagnosing, working with persistent mental illness, working in hospital settings, like we've really, you come hang out with us. That's what we do.
The complex, like I like to figure things out. I like to help. Absolutely. So, and not only, you know, you guys have, you know, the 8 faculty, but you also have all these partnerships in the community with, you know, other psychologists who are then training the practicums for your students, and you know, working so closely with these sites. I mean, I'm so impressed with Augsburg's program.
Well, and it's such an important, I mean, this kind of speaks to, again, this kind of general community value of, you know, how do we make sure that not only we're connecting students with the community here, psychologists, but are we serving the community here, right? And we do have a really strong value towards service, and especially towards underserved, marginalized communities. And I'm just really proud of the work that we've done to facilitate those experiences within the community itself, right? Like, and also I think for students it's helpful because then they really get to connect with us as faculty and don't have to kind of hold that we might also be their supervisor at some time. Like, all the supervisors are out of the university, and so they're seeing real work with real people, and I think that's such a huge advantage to that mentorship model. Absolutely.
And one of the things that, you know, we alluded to a little bit earlier is that these prac students, I mean, the job of a graduate student is at least a full-time job. And so kind of the idea, I know a lot of people think, well, I'm gonna, you know, I really like this work I'm doing. I'm gonna keep doing this and go to grad school at the same time. How well does that work?
It's hard. So I think it's an interesting thing, and I think the field, I will own, I think the field has shifted some. So when I was in grad school, and I'm sure when you were too, there was very much a strong negative stigma around people who tried to both work and do school, and it was very clear from the powers that be that was the wrong choice. I think that there's much more awareness, at least in our program, of the fact that people have lives, and that it is just not realistic for many people in the situations that they're in to put their entire lives on hold for 5 years, for half a decade. That's a very long time. And so I think we're moving towards a place where there's more flexibility. So one example I'll give you is, we historically our program has been 5 years. You get done in 5 years. You start, 5 years later you have a doctorate. We noticed that there were students that had kids that had significant caregiving responsibilities that were we really wanted these people in the field, and the 5-year timeline was not sustainable.
Yeah.
And so what we've done in response is we've created now 2 different ways to get through our program, where you can still do the fast track 5 years if that works for you. Yeah. And if you have other pieces that you're holding, whether it be financial or familial or whatever, that we can be flexible in how we get you through the program. And 6 years is the median for grad school completion anyway. So the 5 years was always really fast. But just that idea that acknowledging that students might have to work sometimes, I still have not seen it successful to work full time and go to school full time, regardless of how many years you want to take. It's just too hard to have your life in that substantial of buckets. But I think now we're seeing students who, especially if they can find flexible jobs, jobs that have some kind of clinical focus, working a flexible part-time job can be really sustaining. And we also try, a lot of grad programs try to have paid opportunities in the programs themselves to minimize the need to get outside help. So we have like teaching assistants. We have some practicums that people can get a stipend for. We are always applying for grants to give people more money. We recognize that it's a significant ask, and so and we have some really nice support from Augsburg too, of having some specific scholarships that will give somebody like a quarter off of tuition the entire time they're there, or $10,000 for the first year that they're there. So we're trying to find other ways to bring that financial piece. So I think there's more flexibility than there used to be, or at least more acceptance of understanding that it's just a reality. That you want to get the degree, and sometimes you also have to work in order to make that happen.
And I get it. I mean, I know that we've worked with a lot of different programs here at Psychologist with grad students, and that is something we look at. Like, are you working somewhere else and going to school and coming to us for a prac, because they just don't have the resources sometimes to put all the energy into taking care of the patients that you need them to have. And so, and that's not, it's individual, right? Like last year we had this amazing prac student, single mom, raising 2 kids, just had gone through COVID during grad. I mean, rock star. And so, we worked with her, right? And but like, for most people, like, normal human beings, they would not have been able to do that.
Superhuman moms.
No. So it is. It's, you really have to prioritize grad school first. And then this is something that you may or may not be able to do, and you have to be flexible enough to be able to say, hey, my success in grad school comes first. I might have to let this go.
And I think there's a big shift for people, especially people who are coming right out of undergrad or who don't have any master's experience prior to coming to a doctoral program, of that shift between what it means to go to class in undergrad, right? Where you could maybe go in your sweatpants, you could maybe go in your pajamas, you could maybe wear headphones the entire time. There's lots of ways to go to class in undergrad, and that shift from that mentality to like what it means to go to a class for your career, not for the test, not for the paper, but to go for building the knowledge that you will need to make the next steps in your career. And so I think that when students who do really well with that transition are often also the students who can kind of handle a part-time job, because they've got this sense of like, here's the way I need to come into grad school. I've already got that figured out. And so I do have a little more bandwidth for taking on a flexible something that's also connected to the field. Right? Versus a lot of students come in and really need to spend that time, especially in the first year, just figuring out how to transition in to what it means to be a professional student.
Yes.
And it's different.
Yes.
It's different.
Yes. Right? Like, I need to communicate with my boss
Yes.
if something's not working, or I'm going to be sick, or calling in, right? Like, it's not just like you don't show up to class. You need to tell people, and you know, things like that, which is like, you know, things that maybe we took for granted in our generation.
Yeah.
And I'm dating you, maybe older than you are. Okay. I'm sorry.
That's okay.
But just trying to instill that, and I love that your graduate school program is doing that. Like, here's how you show up. Here's how you be professional, because your clients are going to expect that. They expect professionalism.
Yeah. Well, and I'm sure you've heard the term hidden curriculum, right? That idea of like. And one of the values that we have is trying to not have so much expectation that everyone knows the hidden curriculum.
Yes.
Right? And part of that hidden curriculum is how to tell somebody when you're going to be late.
Yes.
How to tell somebody when you're going to have to miss. How to ask for extensions. How to give feedback in a way that it's received, right? Faculty need feedback sometimes.
Right.
You know. Right, exactly. And so so that piece of, you know, how do we make sure that we're not making assumptions that people already know that we're really allowing for that to be part of the process too.
Absolutely.
Because it makes it easier for everybody.
One thing that we hit on earlier is you don't have to have a master's program to go into a doctorate degree.
Yeah. Some programs will say you have to have a master's, and typically those programs have just either they have specialized tracks, or they have something different about them that makes them feel like you gotta have this specific kind of education before. Many grad programs, though, many doctoral programs will take somebody right out of undergrad. Okay. Many of those programs also will allow you to kind of get a master's on the way, but it's all folded into this idea of being a doctoral psychologist at the end. Part of this is because, part of the reason we've moved to this is because APA, who accredits us, has very specific classes that they want to make sure we cover.
Okay.
And we really, in a doctoral program, cover anything and everything that you get in a master's program.
Yes.
And then we just give you more to learn and more to do. And so in that way, we don't want people to feel like they have to go get this degree and then essentially re-get it and take all the same classes again.
Yeah.
Now, they're taken at a different, there's different expectations for what you know, how deeply you know it, and how you show that you know it in a doctoral program versus a master's. But we see it as, if you know where you want to go, let's start now.
Yeah.
Let's get you on the path now, and let's just move you through.
Yeah.
Yeah, but I would say every year we probably have about, our cohorts probably come in about half and half. That half will come in with masters, and largely people who realize after they've gotten the degree that they wanted to do more.
Yes.
And so they end up hanging out with us for another 5 years.
Right.
And then half that really kind of had that clarity at the time they were applying and are ready to just jump in and get going. But I think it's really helpful, even regardless of if you have a master's or not. One of the things that most doctoral programs are going to look for is if you've had some experience in the field.
Okay.
So it's pretty hard, I think, to get into grad school straight from undergrad if the only thing you've done in psychology is your degree.
Yeah.
And so the people we find can really successfully transition in and can get in the first place are people who are working at group homes or working as a behavioral specialist in a hospital and really seeing what the field is and still choosing to come is really something that we really take to heart when we're looking at applicants.
They've had some real jobs. They've worked with clients before in some capacity. So back in the day, when I did a PhD program, and it was so important. You had to have research experience to get into a PhD program. Mm-hmm. Now, and I don't know if you can speak to the PhD program, but for a PsyD program or if they're a PhD program, like, is there still an emphasis, like, I did some undergrad research, or I was
Yep.
a research assistant, or
I would say for PhD programs, absolutely it is still expected. Like being part of an actual research lab or being on specific studies, those kinds of things, if you're looking at PhD programs, that's going to carry a lot of weight.
Yes.
For PsyD programs, I think generally, and I can speak for us specifically, generally the clinical experience is going to be the most important thing. That's consistent, right? We're training practitioners. That's what we want you to go into the field to do. So we're going to care about that a lot. For the students who are most competitive in PsyD programs are the ones who have kind of dipped their toes in both areas. They've done some clinical experience. They also have some research know-how, and we do look for both. Like we're very holistic in our admissions process, but we're routinely screening for do they have both of these things here. It doesn't mean if you don't, we're not going to look at you.
Right.
But definitely the most competitive are people who've gotten to have a little experience in both areas.
Okay.
Yeah.
Okay. So another question that I know people thinking about grad school are going to be saying is how much do grades and GPA matter?
Yes. I know, because sometimes you start undergrad and you don't know that you want to go to grad school in 4 years. Right, and maybe you make different choices as a freshman than you do as a senior. No, this happens all the time. So I would say another really big value, particularly in PsyD programs, is this idea, I've said it a couple of times now, I think, that holistic admissions process. That we're not, and for our program specifically, no one particular piece of data gets you off the pile. We don't have, we have a recommended minimum GPA, but if your GPA isn't that, we're still going to look at your application. What we care about the most is our being able to understand your story. So if your GPA is a little lower than you'd like, if we understand why it's that way, and we see that you've really owned that, and that you have thought about the ways that you're going to approach grad school differently, that's much more meaningful to us than having the right GPA. Right? Like what we want to see is that you understand yourself, you understand your strengths and your growth areas, and most importantly, you understand why you want to do this work. Right? And so we're going to look at GPA. Everybody's going to look at it.
Right.
But we're also going to look at how you talk about psychology in your personal statement and what you've done in the field that solidifies you wanting to be here, and what your recommenders are saying about what their experience of you, and so I think in that way there's no GPA where I would say just don't. Right. I think if you've got the drive and you've got the experience, that's going to be more important than whatever number you got in undergrad.
Okay. Great.
Yeah.
Well, and GRE.
Okay. Tell me what it is and
what it means for
grad school. So GRE is this thing that gets thrown around for all sorts of higher ed programs, right? Not just psychology, but if you want to get a PhD in biology or physics or whatever, you're being asked to do this. It's essentially like a more intense version of the SAT. You have a whole bunch of math questions you have to answer, a whole bunch of sort of vocab questions largely, and then there's also a writing portion now of the GRE. It's interesting because when we were applying, and I know when I was applying, it was a huge deal. You had to do it. And you not only had to do the regular GRE, but you also had to do this special psychology one. It's like very, like, do you know enough before you go? What people have found is that the GRE it can be pretty biased toward people with resources and opportunities. And so and that oftentimes your GRE score says less about your aptitude and more about your resources. And so what we're finding, and this is nationally true, for PsyD programs especially, people are doing away with even looking at it. Like not that it's recommended, but not required, not that it's required, like we don't care, right? Because what we care about is your investment in the field. And we're one of those programs. So we very early on actually realized, and also there's some inequity on being able to take the GRE.
Yes.
It's expensive. It
Yes.
costs money. And so another thing that you see is people who can repeat the GRE
Yes.
do better. And some people can't afford to repeat the GRE.
Right.
So we found it a really not helpful data point for us personally. And I would say nationally, I went to a conference this January with other kind of programs across the country. And I think maybe 10% of the programs in that room, granted it was mostly PsyD programs, 10% of the programs in that room were still requiring the GRE. And everybody else had either made it recommended or dropped it completely.
Wow.
Yeah.
That's
So
fascinating.
yeah. And I still think, if somebody's asking me, do they take it or not?
Right.
You can.
Yeah.
I think it would really depend on the type of program you want to get into. If you're only applying for PsyDs, it's really not going to make or break you.
Yeah.
You know?
Wow. And speaking of inequities, there has been a big push in the field for greater diversity for psychologists to reflect the population.
Yeah, and we do not right now as a field.
Right. There's that piece as psychology as a field that we've been pushing this way. And then there's the Supreme Court's decision about affirmative action being shut down. So what are universities, like how are universities, maybe just you can speak to Augsburg, but what are you doing to make sure that on one hand we want a more diverse psychology workforce and on the other hand, our hands are a little bit more tied now with this ruling.
Right. Yeah, it's a huge conversation kind of nationally with admissions especially. And within Augsburg, it's particularly salient for us. We, one of our huge pillars for our program personally is an emphasis on multiculturalism and social justice, and really actively working toward decreasing those inequities that we see in the field, both in terms of access to care, but also who is providing the care, and who has access to those providers. Actually, for us specifically, we have a scholarship that is specifically for students who identify as Black, Indigenous, or people of color. And so we had this conversation of, oh my gosh, do we have to get rid of this? This is really, it aligns with our mission, vision, and values. It aligns with Augsburg's mission, vision, and values. We've really worked with our admissions team to make sure, the really big part of this affirmative action piece, what's the biggest piece of that is that you are no longer allowed to consider a person's racial or ethnic identity in the decision to admit.
Okay.
So that's kind of the biggest piece of that. And so, and we never did in that concrete way. We looked more when we were looking at applicants of what's your commitment to social justice? What's your commitment to a multicultural approach to client care? And I think a lot of schools have moved to that as well. Well, instead of saying you are this identity, therefore you have a leg up, or you have or we're filling some specific quota.
Right.
People are moving to what is your experience? How does your experience show us that these values matter to you?
Yeah.
And so we're seeing that kind of as a national response. For us, with our specific scholarship, essentially what we learned is that because we are not choosing to admit people based on that scholarship, that we can still offer that scholarship to anybody who's admitted. But I think that was a big question at the beginning, can we not even have scholarships?
Yes.
And it's clear now, kind of across the nation, that you can. But I think that this is going to be an ongoing conversation. And what's hard is, especially with grad programs, because it takes so long to get through, we're not really going to know the impact of this on our field and on our graduates until 5 or 6 or 7 years from now, because that's when this ruling came out, when those students will be graduating. But I think there's a lot of really smart people who care about this a lot across the nation trying to figure it out, and it's exciting to be a part of those conversations. But it's tricky. It's tricky because we care about it so much, and the field is so much better when we have more diverse viewpoints. And we can reach more people, and we can be more thoughtful and intentional about how we're bringing things forward into the communities that we serve. when we have more people at the table, right?
Yes.
It's like we want our arms to get wider, not narrower.
Absolutely.
And we're hopeful.
Yeah.
And I think we've got some good systems in place to support that. And there's the pressures from outside, are real.
Yeah.
I think for us, having that value lived out so intentionally in our program helps. And also the broader Augsburg community has been living out, has been ahead of the game in Minnesota anyway, and living out that mission for a long time.
Yes.
So we really benefit from the resources there too.
And I think the culture too, right?
Mhm.
People from diverse backgrounds want to go to Augsburg.
Yes.
So that's another thing too.
I think they know that they're going to be supported here. And I think you can tell when programs are recruiting for performative or to fill a quota kind of reasons.
Yes.
And I think there's so many cues in our program that make it clear that is not the reason, right?
Yeah.
We've got research projects going on that specifically think about anti-racist pedagogy in classrooms, and we have student faculty committees that are specifically designed or intended to better integrate multiculturalism and social justice into the program. So I think some of those things are helpful, especially if you as a student are trying to figure out, like, where am I going to be safe and where am I going to be comfortable here? Look for how these programs are living out their mission outside of the classroom.
Right.
Because inside the classroom, there's actually not a whole lot that's different.
Yes.
The classroom's APA makes us all teach the same thing.
Yes.
But I think when you can see, what are the faculty doing outside? What kinds of student issues are you hearing in those panels that students talk to you about?
Yeah.
Ask directly the questions that you need to know in order to feel like the environment is safe. And you'll get a pretty good sense from just the nonverbals for how people respond as to whether or not it's a good fit for you.
So mental health problems have definitely been on the rise.
Yes.
50% identifying with anxiety and depression symptoms. I mean, we laugh because
it's really
frightening, right? I mean, it's quite
really
hard.
Mm-hmm.
And so obviously, psychologists, trainees, students have to be well to take care of others.
Yeah.
If somebody is in undergraduate right now and they know they want a graduate career, but maybe they're struggling with their mental health, what kind of advice would you give to them?
Yeah, well, I think the first thing I would say is to normalize it. Right? Like, it is okay. You don't have to have yourself 150% figured out to go to grad school.
Yeah.
Right? Like, you can, we hope that you have, the big thing about grad school is you got to have good social support. You have to get some good resources and some good internal coping for, like, when things get hard. But I think that, one of the interesting things about psychology is the psychologist's relationship with their own wellness.
Yes.
Right? And I think a lot of times, actually, people who go into this career in some ways can carry even more shame about their anxiety or their depression or whatever they're holding, because they think, well, I'm supposed to be the one who's got this figured out.
Yes.
And if I can't figure myself out, then what's that about? One of the things that's really important, as this is a really big passionate area of mine, of kind of how do you help keep yourself well. And I think it's really important for us in the field to model that you can have struggles and still be a really strong contributor. And it's not about covering those up or fixing those so that you can. It's more about transparency and community around those things. We have students every year who are really excited about our program and also struggling. And I think the nice thing about being in grad school is that if you can name those struggles while you're in training and get training on how to manage those struggles in this field, it can just make a really significant difference. All that being said, if you already know you're struggling, therapy is the best. It's so great. And I think that if you're interested in being a psychologist in the long run anyway, how great to be on the other side and to kind of be sitting in the client spot. to get a sense of what it's like. And so that way you're going to build empathy for your clients in a different way if you've engaged in your own therapeutic work. I can't recommend therapy highly enough because I think it also helps with some of that stigma before you even get to grad school. Right, some of those messages of, like, oh, if I'm feeling down, that must mean that I'm not up for this.
Yes.
Right? Or it could just be that you're feeling down. Yeah. And because people feel down sometimes.
Right. Now folks are so open about it. And I love that. And that because it brings greater awareness to them. There's not these blind, spots when they're trying to care for clients. And so I really appreciate that. And that they're working on it in grad school, so they're not practicing in the field all by themselves and like thinking they can't get therapy.
The number of supports that we now have available to grad students, at least from when I went to grad school to now, feels like there's vastly more. So we have, if you're a grad student in our program, you can also access Augsburg's Clinical, Center for Wellness and Counseling. And we never put students there at the practicum, so it really can be a space where you can go and get the help you need. We have a disability services office at Augsburg that is phenomenal. And we have so many students who have kind of just muscled through because they're smart, have muscled through things like test anxiety and ADHD and depressed moods for so long. And then they get to grad school and they're like, wait, this is really hard. And we have a great relationship with our disabilities office to help with testing accommodations, with extension requests, with flexible scheduling, and so I think that that there's just not only is it less stigmatized than it used to be, but there's just more resources available to really manage those different things that are going to come up because we're humans.
Yes, exactly.
What I want to see and what I want to bring forward into the field just for myself is this sense that psychologists actually need to and can prioritize their own health, and that it can look really daunting, but that it can make a huge difference in terms of sustainability. I think grad students they're such good workers, and sometimes we over rely on our ability to be good workers. And so one of the things that I think about with anybody who's thinking about grad school is you likely, if you get into a grad school program, you already have the academic skills and some semblance of the start of some clinical skills. You're gonna need training, but you typically aren't accepted into a program unless you have those things. And what I see a lot of students come in not having is, how do I rest? How do I make time for me? How do I build an identity that incorporates being a psychologist but doesn't consume the rest of my life? And I think for sustainability, thinking about that before you come into a grad program of how am I going to be tethered to my own wellness is such an important conversation. And I think we're really good at talking about all the other things, right? Get clinical, we talked about it here, right? Get clinical work, get good grades, get research, but also get to know yourself and really feel like you have a sense of what you need to be well before you walk in the door. We'll help you figure it out too. It's a really exciting, flexible, dynamic career. And you got to know yourself in the middle of that.
You do. We see a lot of doctoral students, physicians, residents, different career, healthcare careers that are going into this business. And that's a big part of what we do. Or people at the undergrad level. Okay, so you're getting your degree in psychology, you want to go to this program. Let's think about these areas that we need to prepare you for and get you ready for so that you can hit the ground running because it is a lot of time and it is a lot of money. We want you to be successful. You want to be successful. This is your passion.
I think there is that colloquial phrase of everybody uses, right, the put on the mask. They tell you in the airplanes, put on your own mask before you put on the others. But I do think that there's some of that can really starting that practice early. And starting that sense of it's such an other focused career, and there's really beautiful things about that.
Yes.
And that also means that we have to be more intentional about bringing ourselves into the picture. And I think there's lots of good ways to do that. And grad school can help with that too, depending on the program. Our program definitely cares about that. But I think there's also an individual piece that really feels important there too.
Well, I am so grateful to you,
Yes.
Dr. Abby Hughes-Scalise,
Thank you.
for coming on and talking to us both about kind of your thoughts and experiences as you know, a psychologist yourself, but also about Augsburg's program. And we just are so grateful for the knowledge. Viewers, if you are seeing this and you have additional questions or comments, please feel free to leave them for us. Make sure to follow and like us. We like us, so we like you to like us.
Absolutely.
And we will see you on our next show. Thank you.